Okay, hello. Good morning, good afternoon, everybody. This is Dr. Apurva Tyagi presenting my topic on knowledge, attitude, and practice among healthcare providers regarding Zika virus. Zika virus is recently declared as a public health emergency of international concern by WHO. Zika virus is primarily transmitted through the bite of Aedes species of mosquito. Zika virus RNA has been detected in number of body fluids including blood, urine, semen, saliva, and amniotic fluid. Therefore, transmission associated with occupational exposure of these body fluid is possible. The potential risk of exposure of large volume of body fluid during the labor delivery process, dental treatment, surgeries, and laboratory process is high. Hence, the use of in these settings is essential to prevent possible transmission of Zika virus healthcare professionals. Zika virus rapidly manifesting itself as a pandemic concern, it is important for all healthcare workers to have a sufficient knowledge to screen the potential carrier and prevent further spread of infection. This survey aims to know that do healthcare providers have adequate knowledge about the cause, effect, diagnosis, and the treatment of Zika virus? Do standard precautions are being followed in healthcare setting to protect from both healthcare service provider and patient from infection of Zika virus? Zika virus is an emerging pandemic disease that has been declared as public health emergency of international concern by WHO on 1st November 2016. Zika virus infection is a mosquito-borne illness which is caused by the same mosquito which caused dengue, chikungunya. Aedes mosquito-borne infection continues to be the major cause of mortality in many tropical and subtropical countries and have potential to rapidly spread to the adjoining countries where Aedes mosquito is present, therefore presenting a greater risk to India and the neighboring countries. 79,800 cases of dengue were recorded in India till October 2016 this year. The major symptoms of Zika virus is similar to dengue and chikungunya, which includes fever, rash, joint pain, headache, muscle pain, and conjunctivitis. But the major complications of Zika virus is microcephaly. Zika virus infection during pregnancy is cause of microcephaly. Other abnormalities include but not limited to the brain atrophy and asymmetry, abnormal formed or absent brain structure, hydrocephaly, and neural migration disorder. And the second complications of Zika virus is GBS. It is a rare disorder where person's own immune system damage the nerve cells, cause muscle weakness, and sometimes paralysis. These symptoms can last for few weeks or months. While most people fully recover from GBS, some people have permanent damage and in rare case people may die. A cross-sectional interventional study was conducted in healthcare providers in Aligarh District Public Health Center and Community Health Center for a sample size of 600 healthcare workers. A self-structured close-ended questionnaire was administered to 600 participants in two phases to record their demographic, professional characteristic, knowledge, attitude, practice regarding the Zika virus. Simple random sampling technique was used. After recording the first phase of the survey, in the second phase, a small presentation about the Zika virus was shown to all the participants. The result was expressed in percentage. Multivariable linear regression analysis were carried out to assess the association of the participants' professional characteristics with knowledge, attitude, and practice. Out of 600 healthcare workers contacted, 536 responded to go through the survey. Demographic variable shows that survey consists of 426 females and 110 male healthcare providers. Majority of healthcare providers belong to 22 and 35 years. It was found that doctor had high knowledge regarding the symptom, cause and mode of transmission of Zika virus than other healthcare providers like pharmacists, laboratory workers and ANMs. The practical score of healthcare workers reveal that about 61.9% of healthcare providers are practicing universal infection control protocol, and about 76.86% of healthcare service providers agree that there should be a stabilization of awareness and sensitization center by the government regarding the Zika virus outbreak. Zika virus epidemic is the latest in the recent series of emerging viral infection with global health repercussions. It is the need of the hour to urgently address this public health emergency. There is a wide gap between the level of awareness, knowledge, and practice among the healthcare workers about the Zika virus. The risk of transmission to the healthcare setting seems to be high, hence should be prevented by following standard control measures. Blood fluid, including blood, vaginal secretion, and semen, and has been implicated in transmission of Zika virus. Healthcare personnel should use clinical judgment to determine whether a patient is well enough to follow an elective procedure. When performing a procedure, healthcare personnel should adhere to standard precautions to prevent the transmission. Standard precautions include hand washing, gloves, mask, protection, face shields, and gowns. Very few such studies have been conducted in India which have attempted to raise the awareness regarding the Zika virus infection among the healthcare providers.
Hello,
Further training and sensitization. Hello.
Zapulva, you can continue.
Further training and sensitization center must be established by the government as a preventive step. Practical training session regarding the Zika virus outbreak should be implemented in academic curriculum. This disease has been notified recently internationally and requires very rigorous surveillance program. Zika virus disease outbreak provides an opportunity to emphasize the importance of adherence to published infection prevention strategy to prevent transmission of infectious disease to all healthcare settings including labor and delivery unit. Overall preparedness is needed for the public health emergency. Hence, we should effectively approach this issue to combat the Zika virus infection. Thank you.